Welcome back. I have Dr. Korc here, who's with Hoag Hospital, and we're going to talk to us a little bit about pancreatic cancer. He is a gastroenterologist and advanced endoscopist. I said it right. Thank you. Well, welcome. It's nice to have you here today.
Thank you. It's a pleasure to be here.
So tell me a little bit, first of all, let's talk about the Anita Erickson Pancreatic Cancer Early Detection Program and sort of what's going on with pancreatic cancer today.
Well, as you probably know, pancreatic cancer is a very deadly disease,
Right.
often because it's diagnosed at a late stage.
Mm-hmm.
So at Hoag, we saw an opportunity to try to catch the diagnosis earlier in a group of at-risk patients,
Okay.
and that's where the idea for the early detection program came about.
Okay, and what does it entail? So how would you screen people early for something like that?
So in general, we don't have good screening tests for pancreatic cancer. Through our program, we identify patients who are at a higher risk based on family history, genetic mutations. For example, if somebody either personally had another cancer and had a genetic analysis done and then were found to have a mutation that puts them at risk for pancreatic cancer, or certain other chronic conditions like chronic pancreatitis or pancreas cysts that might put them at a higher risk for developing cancer. And then we take that population of patients and enroll them in our program, where we get a very personalized approach to each patient. We have a genetic counselor who meets with them at the beginning and assesses their risk. We have a multidisciplinary meeting to go over every case every month. And then we do screening with a combination of MRI and what I do, which is endoscopic ultrasound.
Okay, and before I ask you what that is it like a clinical trial that you're going through?
Yeah, and then it does include what we call a registry trial. So all the data that we collect, we compile, and we hope to contribute to the field of knowledge in the future in terms of who is at highest risk of developing cancer and who we can, or which patients we can catch this cancer earlier.
Okay.
And there's only a handful of programs like this around the country.
Well, and you'd think that, I mean, we certainly have heard about cases of pancreatic cancer, that you'd think that there would be maybe more studies done on it, but I think you're coming to a point where you could actually do the studies, right?
Right, and it's that screening is very challenging in pancreatic cancer because we don't have good screening tests. Even when it's a very small tumor, may not be seen on a CT, and it's not routine we're just unable to, as a medical field, to screen everybody.
Right.
I think in the future we'll have blood tests, but that's still years away, unfortunately.
Okay. All right, so let's talk about what you just said, the endoscopy. Is it a surgery, or how does that work?
It's a scope procedure. Most people are familiar with endoscopy or colonoscopy from their screening colonoscopy. So it's similar. It's a camera on the end of a scope, but there's an ultrasound in addition to the regular camera. So I pass that scope into the stomach, and from inside the stomach we get a very detailed look at the pancreas. We can see the entire organ. And if there is anything abnormal in the form of a tumor or a cyst, we can do a needle biopsy.
Okay. So you would have to do that you still would have to do some sort of incision?
No, this is all incisionless down through the mouth.
Oh,
so
I
just
see.
like your regular upper endoscopy.
Oh, I see. Okay.
So, and then ideally, if we catch a tumor in its earliest stage, we can refer the patient to our team of expert surgeons. And pancreatic cancer can be curable. It's just that so often it's not caught at that early stage.
I see. So what happens once you have done the endoscopy, right? Once you've done that, and then what if you find something? Then what happens?
Yeah, if we find something and it's concerning, and usually in that case I'd be able to take a biopsy and get a diagnosis. And if it's something cancerous, like I said, we have a team of expert surgeons and oncologists at Hoag, as well as radiation oncologists and all the other support staff to treat these patients.
Okay.
And in that situation, the patient could have surgery and have the tumor resected.
Okay.
And like I said, if it's small, usually what we consider small is less than 2 centimeters or less than an inch, it can be curable.
Okay.
So that patient, would still need future follow-up and possibly even chemo, but those tumors are considered curable.
Okay, well that's good news for sure. Other than having a history or maybe pre-cancer of some sort, are there any other early signs or signs of pancreatic cancer? Is there some sort of symptoms that people should look out for?
Yeah, people often ask us that, and unfortunately the signs don't come on until later in the disease. That's getting back to why this disease is so challenging. But certain signs that people could look for are abdominal pain, usually in the upper abdomen and sometimes radiating to the back.
Okay.
Weight loss, although that's a more advanced sign. And sometimes jaundice, which is yellowing of the eyes and skin if the tumor blocks the bile duct.
Oh, I see. Would there be any other indigestion things that would go on, anything like that?
There can be, but often those symptoms are vague, and and could be applied to a lot of other conditions. So that's where it's quite challenging.
Yeah, I would imagine, because it's not very direct at all. I mean, sure, we all have those types of pains, and now, of course, I'm going to think secondarily about it. But no, I'm just saying that there's like you said, so many different things that could go on that could lead you to believe it's something serious, but it's not. But nevertheless, they should always call and talk to their doctor about it. Right.
It's important to check with your doctor, and usually it starts with if those symptoms do come up, it may start with a standard endoscopy, an ultrasound, or maybe a CT scan. And we do hope that if that were the case, we can catch whatever is there early. Right.
So in terms of technology and what we're looking forward to doing, especially when we talk about doing blood tests that are specific to this type of cancer, what are some of the things that you're seeing or looking forward to seeing?
Well, there's a big area of research in what's called microRNA, which is just circulating markers similar to DNA that certain tumors might release into the bloodstream. Okay. So there's research in that field into using those in a simple blood test or even urine test to try to identify somebody who may have a tumor hiding somewhere. Okay. But like I said, that research may be years away before it's actually can be applied practically.
But at least it's on the horizon.
Yes.
Something to look forward to.
Absolutely.
Well, wonderful. Well, thank you so much for the information. I know that even though November is men's awareness for health and a variety of different cancers, this is one to definitely take a look at. So, all right, thank you.
Thank you.
And remember, if you need any information regarding this particular type of cancer, you can always go to hoag.org/pancreatic. We'll be right back. Thank you.